Good evening, friends. Meeting again in the Material Medical section after a long time. In last term, we have discussed the Thuja one part, but a big gap was there and it was not continued. And that's why after big gap, I have decided that we'll start it again right from the start. We'll learn all the aspects and we'll learn few more cases of the Thuja in today's session. So we'll start with this remedy, Thuja again, the Thuja Occidentalis. The remedy which has a big significance in the homeopathy. A remedy which was called to be a big king of antipsychotic and has a tremendous use in pathological cases. And that's why today we're going to learn Thuja from Alan Skinner's. Basically, I want to share two more cases of the Thuja in which I want to share from my clinical practice, and two were absolutely different where we cannot think about Thuja generally. First case was a short-statured man who came to me nearly about 35 years of age. He came to me, a dark complexion, having short neck, and he came having a lower lid, a tumor over there, diagnosed as a case of Chalazion, with a discharge from the eyes, the yellowish mucopollulant discharge from the eyes, and it was little bit painful, not too much painful, but when I started examining, he was not allowing me to examine. It was he was very much cautious about it. It was not even painful, but he never allowed me to touch. And he was diagnosed already a case of Chalazion and actually posted for surgery, but he never wanted to do a surgery. So he decided to come for homeopathic treatment and he was there in front of me. And then I asked, why you have not done the surgery? He said, no, I fear going for it. Actually, I'm too brittle. That word which he has used was I'm too brittle. Anything happens with me, I get lost. It immediately breaks everything in my life. The word which he was used was very typical, so things were very clear regarding it. The first important thing, it is cyst. Chalazion is the cyst of tarsal tumors. It is also called as tarsal tumors. It is a cyst of meibomian glands which secretes the fluid for the moistening the eyes. And that tumor cyst is from psychotic manner. Its constitution was typically psychotic, a short stature, short neck, pot-bellied abdomen, dark complexion, a typical psychotic constitution which was there. Third important thing, which he has directly explained, that he was brittle. That is very important. Delusion brittle he is. If you open the repertory, you'll get Thuja for 3-4 marks in the repertory. Because psychotic persons are always weak inside and they fears that anything happens in their life, they get immediately broken up. So that was the thing with which I have started him on the Thuja 30 in repeated doses for 4-5 days, and I asked him to meet me after 10 days. It was very early in my practice, nearly about 1997-98. After 10 days, when he came, absolutely nothing was there. He told one thing, Doctor, I have started your medicine on third, fourth day. It was swollen and a pus comes out of it. I have kept just my handkerchief over there, and when I pressed it, everything came out, and thereafter it has cleaned completely. It is a wonderful remedy in tarsal tumors, Chalazion. This is very important remedy. When if it is because of the repeated styes, if it becomes a tarsal tumor, then it is stapes agria. But if it is persistently Chalazion right from the start, one must think about the Thuja if the patient is of Thuja. In Thuja, there are yellowish discharges. That is another important thing which you can get. Even the styes are common with the Thuja persons. But the typical Thuja constitution should be there. Then we can think about this remedy, the Thuja Occidentalis. And it had made very immediate result within span of 10 days, and surgery was prevented because of it. Second, another obese person, in fact, a lady, she was not a gent, she was a lady, nearly about 40-45 years of age. She was brought to me and having very severe lumbosacral backache, and she actually came in bending position, little bit forward bending, and she was supported by two persons, and she was quite obese, and she was sitting in front of me in chair, and she was very much in trouble, and she said, I'm having this backache since last 1 year, and it is too dangerous now. I have MRI, they have shown, and there was typical lumbosacral spondylosis was there, lumbar spondylosis, marked spondylosis was there, along with severe pain in lower extremities, and continuous pains were there, and she was not able to sit down. Asked her that why don't you sit? She said that once I sit, it is not possible to stand again. That was very typical with this lady. She said that it will require 2-3 people to make me stand. That is very important. When there is a pain, it is as if someone is drawing from that area in my back. Even in lumbar region, even in sacral region, she had the severe pain with severe pain in lower extremity. So I asked, just lie down over there, and it took a long time. Even she was sitting in chair, it took a long time to stand erect, and go over there on clinical examination table and lie down. She was quite obese. The obesity was central. She was again short stature limb, having multiple warts over there on the neck, even warts around the eyes, and the thick tongue. Asked her to lie down. I examined, and then I asked, how much do you walk? She said that I could not walk more than certain distance. Sorry. I could not walk certain distance. That's what she explained. When I walk, I feel it becomes heavy. I have to sit down, and then again I have to walk certain distance. It indicates she had claudications in lower extremity. And it happens generally in spinal canal stenosis. If claudications are there, there are two important diagnoses. One is spinal canal stenosis, another is diabetes. She was not diabetic. Diabetic neuropathy always produces claudications in lower extremities. So she was not having diabetes. Diagnosis was very clear, and MRI was showing the spinal canal stenosis. The symptom which was very important, that pain in the back, specifically in lumbar region as well as sacral region, which was very, very severe. There was pulling sensation or drawing sensation was there, and aggravated after long time sitting, and cannot stand erect. Very difficult to stand erect. The only remedy in repertory you get is Thuja. So the constitution was Thuja. There was tremendous weakness in lower extremities, like a Thuja. And she was not allowing to examine because that was so painful for her. So typical of Thuja nature was there. I have prescribed the Thuja in LM in repeated doses. And after repeating Thuja for nearly about 1 month in LM11, she And at the same time, I have asked to reduce the weight. Around, I have asked her to reduce her weight nearly about 20 kgs. And I told her total diet plan. And when she came after a month, she has reduced 4 kg. And the thing was that she was able to walk without support. With the first follow up after a month, she was able to walk very clearly. It had made so much change, and she followed the diet. She took the treatment for nearly 6 months, and within 6 months, she has really lost the 20 kg. And she was able to mm, walk a big distance. And she told me, I can walk now 45 minutes without any suffering. So Thuja is such a remedy, which is wonderful remedy to learn. So what we'll do, we'll go with the Allen's again. Open the Allen's keynotes, open Thuja Occidentalis, the tree of life, white cedar, conifer. See what he says. He explains in the first sentence only, he explains the constitution of Thuja, and he explains adapted to the hydrogenide constitution of the gravel, which is related to the psychosis as the effect to the cause. If you don't know the constitutions, hydrogenide constitution, carbonitrogenide constitution, stability constitution of gravel, then always correlate it with the miasms. Carbonitrogenide is purely sorry. Hydrogenide is purely psychotic. And oxygenide is syphilitic. These are three miasms which are correlated with the constitution. And Thuja has a typical hydrogenide constitution. They get aggravated by water, contact with the water, aggravated by in the damp weather. They were aggravated because of the food they consume full of water, and it aggravates. That is hydrogenal constitution, and that's what is common with all psychotic remedy. Natrum self having similar presentation, the lycopodium having similar presentation, hydrogenal constitution. So we must know all those things. So in the first sentence, he explained that it is a remedy from hydrogenide constitution, the first important thing. Second important thing which he explains, Thuja bears the same relation to the psychosis of animal. Pigworts. Pigworts are the cauliflower-like growths around the genitals generally, a manifestation of psychotic miasm. Along with gonorrhea, it is definitely presented many cases. So there is a big manifestation generally, but the pig warts are always cauliflower-like warts. Condylomata. Condylomata are the flat warts which are present at the mucocutaneous junctions. It is a manifestation of secondary syphilis, but it is a psychotic manifestation, mixed miasmatic trait which comes in secondary syphilis. It is a miasmatically condylomata are always psychotic. So when pure primary syphilis gets suppressed, when it recurs, then the condylomata develops. So it is a mixed miasm which develops over there. The syphilis, the psychosis, plus the maculopapular rash of a sori. So secondary syphilis is always a complex. Primary syphilis is simple syphilis. So this is what happens with this psychosis. So figworts, condylomata, and wart-like excrescences upon the mucus and cutaneous surfaces. That sulfur dust to Zora or mercury to the syphilis. So primary manifestations of the two psychotic miasm are always two, either gonorrhea or secondary pigworts condylomata. And these are very important manifestations one must keep in their mind regarding psychotic personality. Generally, they are around the genitals. Second important thing one must think about that around genitals there is sweetish smell which is characteristic of this specific remedy. The Thuja is there, and you must get acquainted with these things because these are the things practical hints which when if one catches very easily he can come to the remedy with the help of such things. So these are two very important things which he has mentioned. Acts well in lymphatic temperament in very fleshy persons, dark complexion, black hair, unhealthy skin. Dr. Rush, your answer is here. This is what is the constitution is there. That is the lymphatic temperament. That affects the lymphatic flow. And that's why it is the psychotic miasm. Lymphatics comes into the role after inflammation sets. So after acute or chronic inflammation sets, it is the whatever the debris necrosed material is there, it has been carried away through the lymphatics. Lymphatics get affected, then lymph nodes. The scrofulous diathesis which develops over there, and psychotic miasm has this. The thuja is having lymphatic, and the temperament. These persons are sluggish, slow in reaction, dull in reaction. That is the lymphatic temperament which you can get in a very fleshy person. They are fleshy, big, dark complexion. That is very difficult. You must think about this. These are the things which are hints in the practice. If you don't get anything, at least these things with which you can start the remedy. Black hair and unhealthy skin. Unhealthy skin means here you can observe many things. The face is greasy in Thuja. The body, there are many eruptions. Generally, eruptions on covered parts is typical of the Thuja that you can catch with the Thuja. Then it is not normal. It has many excretions of the body. That is again of a Thuja. That's why it is called to be an unhealthy skin. So unhealthy skin, that is one important thing which one should not forget. Elements from bad effects of vaccination, anti-tart and sedation. Today only I had a case. I'm treating that. That was a case of sickle cell anemia, and she was improving with the homeopathy in the last 2.5 months, 3 months. She was improving. Her HP was increased, which was not there earlier. They were continuously giving her iron and everything, and nothing was working. And she had a sickle cell trait, and she was not recovering. But after starting the homeopathic medicine, she was recovering, and her HP right from 7 to it has increased to 9.5 after homeopathic treatment of 2 months. And she was doing well. And today, after gap of 3 weeks, she came again. And today, I again got. I saw her little bit pale. I asked, "What's the matter?" They said nothing. But she is not eating since last 4 or 5 days. Her weight was reduced. So I was examining, and then all of a sudden, her father told me, Doctor, we had given her a 5 years vaccine, and thereafter she lost her appetite as well as she is looking pale. See, this is the problem generally which happens. People they goes on giving the vaccines again and again and creating the problems. The health is totally damaged because of it. So a good case gets spoiled. It happens many times. I have seen one patient CL stomach with metastasis. I have recovered completely. Her ascites was gone. She was able to work in field. Everything was fine. And one of days she brought after 15 days, 15, 20 days, she was brought to me with a big ascites and lost everything. And then I asked, what's the matter? She was last follow-up, she was absolutely normal. And then they told me, we have taken COVID vaccine. And immediately after vaccine, everything had changed. I lost that patient only because of vaccination. It was not possible because already she was a case of CA stomach with metastasis and she lost because of the vaccine. So there are many hazardous effects which develops because of vaccination. One never looks towards them. So this is one of the remedy one should think about. Thuja, most important remedy. Second important, if the cup is rattling cup, then you think of anti-tuff where the tongue is thick, whitely coated. Cilicia is another, the most chilly personality, again with sweaty palms and soles. Then you can think about the Cilicia for the bad effects of vaccination. So these are three important remedies one should not forget for the bad effects of vaccination. Elements from suppressed or mild treated gonorrhea. Medorinum is another remedy which is mentioned over there. I have shared, I think, that case last time. I do not recollect, but I think I have shared a small child who was brought to me for recurrent respiratory complaints, the asthmatic bronchitis, and continuously 3 years, 3.5 years child, and he was right from the birth continuously he was suffering, and he was continuously on antibiotics, the bronchodilators and anti-allergy, and everything every month was going on, and he was suffering a lot. So I took the history, and he was typically a Sina at that time. The state was Sina. So I took the history, everything found to be a Sina. He was having over voracious appetite. He craves the sweets. He used to sleep on abdomen. He grinds the teeth during the sleep. Then he was very obstinate, very much shrieking child, crying child. So all things very were full of Sina. So I have started him on Sina. The family history, nothing was told. The past history, nothing was told. And they have explained, they have brought the file and full of antibiotics. So I started the Sina, and after giving the Sina, within 6 days, 5 to 6 days, the child was brought all of a sudden. And then his father told his cough was completely stopped immediately next day after starting your medicine. But since yesterday he has one problem, and he from his urethra, a continuous yellowish pus is coming out. And then he commented that this I had 5 years back, 5 to 6 years back, I had the similar type of problem, and they have treated me with the penicillin. See how the miasm is transmitted. Suppressed gonorrhea in the father parent is transmitted directly in the suppressed state to the child, and after right stimulus, it came out. That was very typical yellowish mecopurulent discharge. The child has changed completely with the Sina. He has become mild. He was thirstless and absolutely different child within 5 6 days. So depending upon situation and all those things, I have given him pulsatilla at that time, and pulsatilla recovered him. Now this fellow is 40 years. It was very early in my practice, very early. He was not 40, he was just 30, 32, 32. Yes, at present. He's doing a good job, IT company. But thereafter, he never had an asthma. And these are things which we used to observe in our practice. Whatever Hahnemann have discovered, invented, have a real meaning. They are experimented. And this is what he explains from elements from suppressed maltreated gonorrhea to bring out that gonorrhea. Thuja is one of the important intercurrent remedy which we can use. Another is medorin. If the patient is chilly, give the Thuja as an intercurrent. If the patient is hot, give the medorinum as an intercurrent. See, this is how I used to look toward the cases when I used to use it as an intercurrent remedy. So this is wonderful remedy one should not forget in such types of cases. And last paragraph today we're going to discuss is related with the mind. Fixed ideas, that is very typical with the psychotic miasm. As if strange person were on anti-side, as if the soul and body were separated. Fixed ideas as if living animal were in the abdomen. Fixed ideas of being under the influence of superior power. And these are the traits which are common with the OCDs, obsessive compulsive disorder or neurosis. These are the things which are common with the paranoid schizophrenic patient. They are very fixed and rigid. They never change their thoughts. I have shared one example that lady was brought to me for a headache, and some doctor told her you have headache because you don't have blood. And then when he has given one bottle of blood, she felt better. And thereafter, she was changing the doctor because the doctor who was not giving her blood, she used to change the doctor. And she has consumed nearly about 39 bottles of blood before coming to me. It was an obsession in her case. Fixed ideas are like that. They're never, this never changes. They never goes out from their mind. So she was ultimately treated with this remedy, Thuja, and Thuja removed her fixed idea. Thereafter, she never required the blood bottle, but she required Thuja in even in CM potency I have given. and her whole problem was settled with the help of this remedy. So it is a wonderful remedy for such types of fixed ideas and traits which develops there. And these are paranoid states and of being under the influence of superior power. This is quite common with the paranoid states, schizophrenic state. These are insane people. So what he says, insane women will not be touched and approached. Their insanity, the madness. If you try to touch, they will not allow. They will not allow absolutely. And you observe on their faces, they are insane. So this is very, very important thing which you can think about. Fixed ideas means rigid ideas. I have shared last time one example that example of cat. Yes, Shahrukh has said that I have given the example of a cat. It's a joke, but it was very interesting joke regarding the fixed idea. A lady who came to doctor and said that there is a in my abdomen there is a cat. Doctor explained everything, but nothing happened. Then she was given the tranquilizers, and that also never worked. And then he ultimately referred that to a surgeon. And sir, with surgeon, it was she also tried to help her by telling her that it is not possible, etc. But she was not ready. Then he said, "We'll do operation and remove the cat from the your abdomen." And they have given the anesthesia and just a small cut, stitched it, and brought one cat to show her to remove this idea in her mind. And they were ready with the cat, and patient was in anesthetic phase. And as soon as she came out, immediately first question she asked, asked, where is the cat? And doctor showed, yes, this is the cat which we removed from your abdomen. Patient started laughing and laughing and laughing. And then she said, in my abdomen there was a black cat and this is white cat. You cannot remove these fixed ideas unless and until you use the antipsychotic remedy. Puja requires such types of patients. So the things which becomes fixed are rigid. These are the typical of obsession. This is one important remedy one should not forget. I think today we'll stop over here. Tomorrow we'll cover one more part. I think it will require 2-3 lectures for completing the Thuja. Wonderful remedy, having a lot of things to learn in this remedy. So that's all for today. We'll meet again on for it tomorrow, same time. Be there. And
Sir, one,
yes.
sir, one question, sir.
Yes.
Regarding the touch of antimcrude, arnica, and thuja. Can you, sir, help us to understand these three?
I could not understand your question.
Sir, regarding touch aggravation of antimcrude, arnica, and thuja.
Arnica, it is because of pain. Arnica, it is actually painful. Patient is not allowing you for the purpose of getting the pain severe. The sore bruised feeling which is characteristic of the arnica, and because of which they are not allowing you to touch their part. That is related with the injury. In case of Thuja, they never allowed you to touch their body. There are many, many fixed ideas in their mind. First is delusion brittle he is. Delusion, his body is made up of glass and it will break if someone touches. So inner weakness is very marked with the Thuja. Psychotic miasm itself has the typical inner weakness. And that's why they never allow you to come too close to them. And that is the difference between arnica and Thuja regarding it.
And then, sir, antimcrude.
Antimcrude is different. Antimcrude little bit part is there with the similar thing, that is the psychotic element, but it is not that severe that Thuja has. Antimcrude generally never allows you to touch their corns specifically. The corn tendency which is characteristic and the painful corns are typical horny painful corns are the characteristics of the anti-influence associated with thick coated tongue. And then if you try to press their corn, they never allow because it is too painful, tender. That is the anti-influence.
Thank you, sir. Thank you, sir.
Okay. So we'll meet again tomorrow, same time, with the same remedy. We'll require 2-3 lectures. Thank you being there. Thanks a lot for everyone, and we'll meet again. Good night.
Thank you, sir. Good night.
Good night.